Hello, my name is Gina Clark. It is a pleasure to be here with you today. I have the honor of serving as the president of the Amerisourcebergen Foundation, a role that is very close to my heart. Since our establishment in 2014, the Amerisourcebergen Foundation has been committed to making investments in local communities to improve the health and well-being of humans and animals around the globe. It is what motivates us every day, and it is ingrained in everything we do. From our work to combat the opioid epidemic through safe disposal, prevention education, and innovative solutions, to supporting access to health care for underserved populations, and in our disaster response efforts, the Foundation has worked with more than 100 nonprofits in 2019 alone to create a sustained and global impact. This year, we had an even greater opportunity and responsibility to fulfill our purpose of creating healthier futures as the pandemic took its toll on everyone. To have any impact on addressing a health emergency, we believe that you must partner with like-minded not-for-profits to share resources and knowledge to reach those local communities. That is why the Amerisourcebergen Foundation donated more than $1 million in emergency grants to pandemic response efforts to more than 20 nonprofits, including AmeriCares, Direct Relief, and Healthcare Ready. This allowed organizations to concentrate on the communities hardest hit by the pandemic. We also paid specific attention to organizations that were focused on providing support to diverse communities and give that support in a targeted and culturally responsive way. And while we're proud of where we focus our efforts, we know there is much more to be done. And we will continue to support those most affected by COVID-19 by addressing health disparities and strengthening our own diversity, equity, and inclusion focus, both inside and outside our organization. Today, I am honored to be joined by two colleagues to discuss how, through collaboration, our organizations have been able to meet critical healthcare challenges in underserved communities by supporting local sites of care, like pharmacies, and addressing the mental health needs so prevalent in the lives of our healthcare professionals during this time. So first, I'd like to welcome Tara Waters, Director of Business Development for AmeriCares. Tara manages strategic partnerships for emergency programs and U.S. programs, and she's also critical in evolving those partnerships into long-term collaborative relationships, evident by the 15-plus year partnership between AmeriCares and Amerisourcebergen. I've come to know and appreciate Tara over the last few years, and it is a pleasure to welcome her today. I am also thrilled to be joined by Chi-Chi Moma, Chief Operating Officer at Springfield Pharmacy, located just outside of Philadelphia. As an independent community pharmacist, Chi-Chi is not only a critical member of the business community in Springfield, she is also one of the most accessible healthcare providers in her community. As a frontline worker, Chi-Chi and her team have worked tirelessly to ensure their patients continue to get the care they need in the face of a pandemic and to serve that community in new and innovative ways. Chi-Chi and Springfield Pharmacy is part of the Amerisourcebergen's Good Neighbor Pharmacy Network, which includes thousands of community pharmacies across the nation, providing such valuable care during this time. So welcome to Chi-Chi. I'm so proud to have you here, Chi-Chi.
Thank you.
And with that, let's dive in. I'm going to throw this first question to Chi-Chi, but Tara, I'd love for you to add on as well. Chi-Chi, we know this has been an unprecedented time globally, and COVID-19 has taken its toll physically, mentally, and economically. From your vantage point, how has the COVID-19 pandemic especially impacted healthcare workers and health professionals such as yourself and your colleagues?
First of all, I would like to say that we are burnt out. We are every day trying to figure out ways to adapt with what is going on in our nation and in the world, and being able to be flexible and still accessible to our communities. Healthcare workers, I call superheroes. And no matter how tired you are every day, you still have to put that cape back on and go out there and be accessible to your patients. The cost of working and not working has increased. The cost of just running a pharmacy or running a business has increased. We have had to pivot every day, different ways to make healthcare accessible to our patients, whether it is increase in delivery, increase in telehealth or telemedicine, curbside deliveries. And our communities expect us to be open, and they expect their medications to be readily available. And it does not matter how physically or mentally tired we are, we still have to show up for them every day.
Chi-Chi, I know we all have seen pictures of us all rightfully applauding the doctors and the nurses, and they are doing tremendous work. But as you just described it, you guys are too, and you are receiving our applause every day, even if you can't see it. But I know that mental health strain that you reference is something that matters deeply to Americares. And Tara, I'd love to hear you speak about how you believe that COVID has impacted healthcare workers and health professionals.
Absolutely. Thank you, Gina. So, Gina, as you know, Americares is a health-focused humanitarian organization. So supporting frontline health workers like Chi-Chi has been a longstanding priority for us. Over the last many months, as we have worked to put PPE into the hands of health workers who were unsure where their next mask was going to come from, we have heard so many stories of feelings of stress and anxiety and exhaustion, like Chi-Chi is mentioning, and loss. We have one health worker who told us he's the father of 8, and he's unable to relax. He is always on alert, afraid of bringing the virus home to his family. And we've spoken to those that have lost coworkers, and one in particular just said to us, the grief is real, and it's just one day at a time for her. So, health workers deserve our support, and through, as you mentioned, Americare's mental health programming and other interventions, we're giving them the tools they need to maintain their own health and continue to care for patients. But I want to note too, like Chi-Chi, I can tell the health workers that we work with are so resilient, and they are driven by this calling to serve, even throughout the pandemic. So Americares, as you know, Gina, runs clinics down in Colombia serving the Venezuelan migrant population. And a couple of our staff down there, I was speaking with them recently, and one said that, he told us that working at Americare's clinic is really the best thing that has ever happened to him. And though he fears contagion, he's concerned, of course, but that caring for patients is what boosts him. And, I believe you're superheroes too, Chi-Chi. One of our colleagues refused to be called a hero, as so many of you guys do. And instead he said he's an instrument, and that he took an oath and it's his duty. So, we believe that despite our colleagues' humility, that health workers are heroes. And I just want to note that in addition to those serving in the pharmacies and those in the ICUs and in the testing centers and testing sites, I just want to draw attention to those that are serving in the free and charitable clinic too. These are the ones serving the uninsured and the underinsured. And Gina, you mentioned the economic toll of COVID. So these safety net clinics are caring for the essential workers and the homeless and the newly unemployed. And as was mentioned earlier today, with the recent job losses, these clinics are seeing an increase in the number of patients, some 4 times over. And, these clinics, they're nonprofits. They have volunteer staff, limited budget, limited access to PPE, and they rely on Americares and by extension, Amerisourcebergen and our other donors to keep their doors open. And, as Gina, you mentioned, keeping the doors open on these clinics is so critical to promoting health equity and access and inclusion in this country. And so as we think about the toll on health workers around the world, I just invite us to remember the safety net sector as well and the compounding pressures they're under.
Well, Tara, particularly the safety net comment, so very real in our world, and maybe something others don't always think about. And I want to kind of ask a related question, Tara, to you, but I'll also say that I already see great questions coming in through the chat. So we will get to those, everyone. We're going to kind of save them toward the end so we can be sure and organize them well. But thank you. Please keep sending those questions. And Tara, just to extend a little bit on what you were saying, you know, at Amerisourcebergen, and we referenced our partnership, we have been working closely with organizations like yours, really embedded in the communities to try to quickly expand access to quality care. We all know there are healthcare disparities, and they are real and they are tragic. During COVID-19, can you speak to what this support has meant to AmeriCares, and how has it helped you make an impact? We want all these companies to go do the same kind of thing. So how is this helping?
Absolutely. Well, yes, the early support of key strategic partners like Amerisourcebergen has been critical to AmeriCare's ability to scale up and to launch a coordinated global response to COVID. So for this work, we are grateful. But when I consider what is unique about our partnership and what has really elevated our impact during COVID, I think of a few things. The first is flexible funding. So Gina, you came to us, you said, here's COVID funding, put it where you need it most. And, you know, this is always helpful, but during COVID, it was critical. It's been critical because it enables us to pivot and address the areas of greatest need, which, you know, as Chi-Chi can attest to, has been changing and evolving over the course of the pandemic and continues to do so. So that flexible funding has been so important. The second factor that I think has actually elevated our impact is actually Amerisourcebergen's commitment to our non-COVID programming. So, during the course of the pandemic, Amerisourcebergen renewed and deepened its multi-year commitment to AmeriCare's U.S. Behavioral Health Initiative. And right now, that is so important to ensuring that underserved populations have access to care for chronic illness like diabetes and hypertension, and in this case, mental health. This is an important part of responding to COVID. So with partners like yourself, AmeriCares is working to ensure that these vulnerable populations are not suffering from or dying from preventable and treatable illness as a result of an overburdened health system. So the flexible funding and that ongoing support are so important. And then finally, I would say the third factor that's really elevating our impact is the annual course support that Amerisourcebergen provides to AmeriCare's emergency programs team. So right now, that reliable funding has enabled us to respond across 26 countries to COVID-19, but also to respond to the wildfires out west and a record-breaking hurricane season and the typhoons in the Philippines and all the other natural disasters right now. And COVID-19 is complicating response and recovery efforts around the world. And this reliable funding has really enabled us to have the readiness to respond. So, taken it holistically, I do believe it's that multifaceted, multi-year support that has actually elevated our COVID impact. So, we are grateful, and we couldn't do it without you.
Well, thank you very much. And it is truly our honor to do this. And as you kind of detailed all the things happening in 2020, because it has been tragic with COVID, but there have been so many other things going on. Our responsibility to work with organizations such as AmeriCares is one we take profoundly and take very seriously. I want to ask one question now, additionally to you, Tara, and then Chi-Chi, I've got a big question coming up for you next. But Tara, you kind of touched on this a minute ago, the mental health aspect of all of this, and I kind of mentioned it earlier as well. Those are dramatic, the mental health aspects on the frontline workers, such as Chi-Chi referenced, and then those of us that are just trying to keep it all together every day and take care of our jobs and our families. I think those frontline workers have the biggest job and the toughest time. Tell us more about your efforts to address those.
Certainly. So providing mental health and psychosocial support to COVID-19 frontline health workers has been a priority of our response. As you know, Gina, mental health is a core expertise area at AmeriCares. So to support COVID-19 health workers, we were able to really leverage this expertise and years of experience to really build out and develop a COVID mental health training program for health workers to help them manage their fear, their stress, their anxiety, so that they can maintain good mental health and continue to care for their patient population. So the topics that we cover include things like stress management and self-care, but also dealing with grief and loss, and how to navigate stigma and discrimination and implicit bias in a COVID context. We also provide the health workers with the tools that they need to really identify and address mental health needs in their patient population. This is through offering psychological first aid or special modules on helping children and adolescents deal with grief and loss during COVID. We offer one-on-one counseling for acute crisis management, and also group sessions where health workers can hear from one another and learn from one another. So to date, we've received some really great feedback where participants are saying that the workshops have really validated their emotions and given them peace of mind. One participant in particular, she said that attending the workshop helped her find herself again. She said that amidst this intense routine of work and school, work and home and family and potentially school, caring for her family, that she really forgot about being. And she thanked us in the end by simply saying, "Thank you for the space." Thank you for the space. You mentioned, Gina, that how it affects all of us. And, that concept just makes me exhale thinking about it. So to date, we are grateful for the opportunity to support health workers. And we've so far trained about 12,000 participants in COVID-specific mental health, and we're only just getting started. We're launching an online learning platform where all of our content will be housed for health workers around the world to access. It'll be open access, so whether you're a provider in rural US or a community health worker in Haiti, you can access this information. And the vision is really to put those skills in the hands of health workers who would otherwise not have access to that knowledge, build their resilience, their capacity to serve, and ultimately improve health outcomes for marginalized communities all around the world.
That is such an amazing and outstanding program. I have to believe, Chi-Chi, that was hitting close to the heart for you and your colleagues. You are, again, on a front line, and it is our community pharmacies and our neighborhood pharmacies. You know that those are near and dear to my heart in Amerisourcebergen. I believe so much in what all of you do. Can you talk a little bit about that role during COVID and the role that the pharmacists are playing specifically?
We are educators and we advocate for patients. I mean, and neighborhood pharmacies deal with a lot of culturally diverse population. And the patients, they love to feel seen, they love to feel heard, and that is what makes our job very fulfilling. And during these unprecedented times, patients have a lot of questions, there's a lot of anxiety. They will ask, Chi-Chi, what do you think about the COVID vaccine? Would you take it? I can't answer questions personally. I have to make sure I answer the questions with facts. So we have to not only be educators and advocate for these patients, we have to make sure that we're in tune with what is going on in our world and make sure we answer the questions with facts. And these patients are not only relying on us to help them get access to their medication, but also making sure they get the right medication at the right time. I mean, we partner up with Amerisourcebergen because in the beginning of the pandemic, it was very difficult to get most COVID essential items or products. And having a vendor relationship that knows how to allocate these products for every pharmacy in all these communities to have access to the products on time and have enough of it on time is very critical for us. You know, we're worried about drug-drug interaction, and at the same time, we're worried about getting our hands on the products at the right time. So it is a lot for us, being able to be flexible, being able to adapt, being able to stay informed of the facts, and being able to be there for our communities and meet them right where they are, and explaining things to them at their level and being accessible to them when they need it.
You know, you hit on such an important point, Chi-Chi, there, and I'm gonna be a little risky here because I'm proud of our pharmacies everywhere, our chain pharmacies and our community pharmacies. But I would tend to think that our community pharmacies probably have little bit of a different role. If it's okay to use the word, a little more intimate with your customers. I mean, you're their pharmacist, you're their medical guide, you're their friend. Maybe talk a little bit about that unique role of the community pharmacist.
You get to know these patients intimately, like I say. You meet a grandma, for example, you know about her children, her grandchildren. You celebrate their holidays with them. You don't even really have to be from the same culture or background, but we celebrate everybody together. So they become part of our family, it's what we call it. And they expect to see me there or see the rest of my team there when they come in. And it gives them a sense of security. It gives them a sense of belonging. And it becomes their pharmacy, their pharmacist. It's an extension of their home. And for them to understand what the other healthcare providers are telling them has to come through us, has to come through our pharmacy. So we become the liaison between them and the other healthcare providers, liaison between them and the insurance companies. It's like we are jack of all trades. I hope we're master of all of them, but we are a jack of all trades.
Well, having my own community pharmacy just a few blocks away, you just described it perfectly. So, and it's kind of like walking into my healthy cheers, if you will, because it's always like, Gina, welcome, glad to see you. So thank you for that. And maybe one more question specifically to you, Chi-Chi, and then we've got some great questions in the chat, so I'll go to some of those. But, Amerisourcebergen, you referenced it, we're embedded in the supply chain, so we live and breathe that every day. And I've been so proud of our distribution centers and the extra work they've been putting in trying to make sure that you do get what you need to serve your patients. How, from your point of view, how has the supply chain been impacted from the pandemic? And, everybody wants to know what you think about the vaccines that are coming. What are your thoughts?
From a supply chain standpoint, in the beginning of the pandemic, it was rough. It was very, very hard for us to plan ahead, for us to project how many products we need to get in to serve the population that we have. But Amerisourcebergen was very good with being able to balance it out. That's why the word allocation comes in, where they allocate a certain amount per distribution center, per region, per community, per pharmacy, based on our buying habits, right? And we also being able to buy certain things from different distribution if the demand is there. And yes, a lot of people do ask me about the COVID vaccine. And our community pharmacies, mostly independent pharmacies, are well equipped. I mean, using the flu vaccines, for example, independent pharmacies offer high flu shots than most doctors' offices, and the providers in the area are able to channel their patients to us because we see them first. We have a relationship with them. We can convince them to get the shot better than other people in the doctor's office. So, and I believe that as pharmacists, we are equipped to be able to help vaccinate everyone for the COVID vaccine. And we're ready. We're preparing, we're ready. We are filling out the necessary documents that we need to, but we are ready to help the community, to help our patients, to help America get this together.
Thank you, Chi-Chi. It's just so very meaningful as we are now beginning to see those lights at the far end of the tunnel, knowing that there's a partnership and the passion with which you and your colleagues and pharmacists take their role in getting those vaccines out to everyone, getting those very important shots. So we have a few minutes left and we have some questions. I'll take a couple that came to me just to give Tara and Chi-Chi a chance to catch their breath, grab some water. So if I look over here, I've got a question about, as a foundation, how would I like to see change and how companies share or talk about their CSR efforts as it pertains to nonprofit or philanthropy? Well, I could talk an entire 30 minutes on this, but I won't. I'll talk just briefly and say, doing what we're doing right now. So I think that having very transparent, open conversations about what we do, the work we do with AmeriCares, the work we do with even smaller nonprofits like Family Reach, who serves the families of cancer patients, or Aluna, who serves the families of children of families of addiction or death. We talk all the time. We get out of there and talk about those particular efforts. I mean, all of us want to continue to help stand up and support the big organizations because they are doing good work. And they've struggled during this time too. The American Cancer Society, the American Heart Association, everybody's been impacted by COVID and their fundraising. But these efforts that we're talking about today, I think that us getting out and taking every opportunity to talk about them in detail, to talk about the mental health offerings of AmeriCares, to talk about the partnerships that our pharmacies have with us to address community needs. That's what is most important. And even as recently as last week, our board, while telling me we're proud of what you are doing with the foundation of Amerisourcebergen, we don't think you're talking about it enough. We think that the world needs to hear this. It's what inspires us all to go the next step, and you need to be talking about it and talking about it at a level of detail that people can turn around and embed that in their own practices. So I hear that, and I will continue to try to tell our story with partners such as Chi and Tara. So thank you for that great question.
Could I just add?
Please go, Tara.
One comment to that, and that this is just to shed light on the great work that you guys are doing. I think one thing that you guys do exceptionally well from a CSR perspective and sustainability perspective is you bring your nonprofit partners together. I think it's really incredible and unique how you bring us together to learn from one another, to partner with one another. The number of partnerships that have been born out of your conferences is just incredible. Hey, I'd love to extend our mental health support services to Chi-Chi's staff and her partners, right? And so I think that is exceptional the way you do it, and I think it's a model for other companies as well.
Well, thank you, Tara, and kind of a quick comment to that, and then Chi-Chi, I'm going to throw a question to you. We've done our foundation conference that Tara mentioned a couple of years. This year, clearly, we had to do it virtually, and we were like, "Wow, how are we going to pull this off virtually?" Like we all worried about in the early days, right? So what we did, I have a tremendous team led by Susan Lorenz Fisher at our foundation office, and we were able to create a virtual day-long conference, much like we're doing here. And just as Tara's describing, it was amazing to watch, even in the chats during different presentations, people connecting and saying, let's get together after this, or I've got a way we can work together to address this small community challenge. Collaboration is almost always the key to solving problems. So Chi-Chi, kind of a pivot into another subject. The question is, how has COVID-19 affected your vendor relationships, and how do you support each other? I hope you're going to say that it gets better, but please speak the truth. How has it affected it?
Our relationship with our vendors we need our vendors to keep our doors open. That's the truth, right? And during this pandemic, I believe it's a relationship that's gotten stronger because we constantly are having communication, because communication is important. We're constantly dialoguing and trying to figure out how they can best serve us better and how we can stay compliant as well to be able to have access to what we need. There's been challenges on how accessible things are. Yes, it's worldwide and it is affecting everybody, but Amerisourcebergen has really been great to us in giving us what we need when we need it. Yes, the cost of things have gone up, but that is across everywhere, not just the medication, even the grocery stores, but just that communication, keeping that, and also training. Amerisourcebergen has been rolling out some trainings on how to help each of us operate at the top of our license is what I call it, right? So that has really been very, very important for us. So we're not in it alone. We feel like we're not alone, that we have the support that we need, because we need the vendors to do what we do best.
Yeah, Chi-Chi, you mentioned something that I think is so important. And for those of you listening that don't know the phrase operating at the top of their license, is I'll just lobby for something here. I think it is so important for our pharmacists to be able to do this. It is how they can better deliver care at the community level. So if you don't know what it is, we won't use time to try to explain it. Go look it up. It's important. It's very important. Guys, we've got so many great questions. I may not get to all of them, but I'm going to try to hit one that you kind of opened up the dialogue on, Tara, and that's really around the social safety net. And I think it's a question probably I'll ask you to address, and then I'll try to speak to it from our perspective as well. And the question is, with regard to the social safety net, particularly with regard to healthcare and food insecurities, both exponentially increasing, how are you rethinking your approach with regard to partnerships such as ours, and also how individuals can better connect? So I know, Tara, this is a passion of yours and Americare's. If you want to start, and then I'll add a couple of thoughts.
Sure. Well, I think that as I had mentioned earlier, that health equity and access for marginalized communities is actually core to our mission. It is what we are about. It has been core to our mission for a long time. So I don't know that we're necessarily changing that. I think we are doubling down on that and making sure that all communities have access to health. I think, COVID has definitely shed light on health disparities in our country. And so that is an area that we are continuing to support with Amerisourcebergen's support as well. And we see this as a global mission for communities all around the world that are disadvantaged or are discriminated against, and making sure that they have access to care is just critical.
I'll just add to that I think one of the things we've tried to do this last year, and particularly during these last few months, is try to use every demographic research support vehicle that we could to help target this support. I mean, we had general, good direction to go there, but we've really gotten very specific to be able to go into areas that need it the most. So if it's perhaps to your point, Tara, it's not rethinking our approach, it's doubling down, it's refining our approach, it's getting laser focused on where we can make the most impact in the shortest amount of time. And I think you're going to continue to see us do that. So I do know we are now really going to be running out of time soon. So I will just say thank you to all of you. We have more questions, so maybe one day the Chamber of Commerce will invite us all back to continue this discussion. But this has been a great dialogue. Chi-Chi with you, Tara with you. Many thanks to the U.S. Chamber of Commerce for providing this venue to have this conversation. And with that, I'll turn it back over to our host, and thank you very much.